Hi, I'm Dr. Lenora Coleman, President and founder of Healing Our Village. I'm really excited to be here today to talk to you about coronavirus, the truth about it. This is actually part of a series called Ask the Black Doctor that's being sponsored by the Atlanta Medical Association. And we have a number of amazing practitioners here to give you all the information that you need to know regarding the coronavirus and what are the myths, what's the real things that we need to know. And so again, thank you so much for tuning in. Today we have with us an amazing physician. Her name is Crawford. I actually met her at a National Medical Association regional meeting. She is an adjunct professor at the Morehouse School of Medicine. She focuses on community health and preventative medicine, and also actually has done some work in the naturopathic area where she's taken several courses regarding naturopathic medicines. So thank you so much for coming today. I really appreciate you being here.
Thank you so much for having me, Dr. Coleman.
Good. So listen, I want to just start off with what should we think about just in general in terms of taking care of ourselves and doing a better job of that?
I'm glad you asked that question, Dr. Coleman, because as a family doctor, I look at things holistically. And although we're talking about social isolation and not touching and all the things that they advise, hand washing and so forth for coronavirus. However you look at it, this is anxiety provoking. And if the anxiety may come from being laid off your job, not going to school, wondering what's going to happen, or being at home with all of your family that don't spend that much time together.
That's right.
Kids running around, and even spouses, that aren't used to being at home together for that many hours at a day may all of a sudden be home. You may have anxiety about childcare issues. There's so many things aside from the illness itself and worrying about catching it. So in our community, we have a lot of hypertension and a lot of diabetes. And both of those things can be aggravated or exacerbated by stress.
Right.
And this is a stressful time. So you want to really stay on top of your blood pressure and take it more frequently and know what's going on with your blood pressure. You want to check your blood sugar if you're diabetic and see if that's out of whack, because neither one of those things necessarily give symptoms. They can be abnormal and you may not know. So you've got to stay on top of those things. And then what I would suggest is do what you need to do to manage your stress.
Yeah.
That might be prayer. It might be meditation. It might be taking a walk in nature, exercising, playing basketball, music, listening to music, dancing, laughing, watch some comedy shows if you're off work.
Yeah, exactly.
And if you need to, seek therapy. Sometimes it may just be too much, and you may need to get the assistance of a mental health professional.
Yeah.
So if you need therapy, you need counseling because just all the stress is overwhelming you, don't hesitate.
Yeah, that's important.
Or if you just have time off work and you have leave with pay, you just might want to go see a therapist for some old stuff that's been bugging you for a while.
Exactly.
Maybe you got time to deal with that now. So the point that I'm making is I really want people to address the stress in their lives, because it's not only the coronavirus that can make us sick. All these things surrounding it and our pre-existing conditions can be worsened by this period of time.
Yeah, it's
right
definitely
now.
a stressful period. So in terms of naturopathic medicine and some alternative medicines, a lot of folks maybe don't know what alternative medicines are. So I want you to just real briefly talk a little bit about what they are exactly.
Let me talk about that field just for a minute. What we're talking about has different names, synonyms: alternative medicine, integrative medicine, complementary medicine, supplements to holistic to Western medicine or allopathic medicine. So there are different terms that you may hear, but basically most Western allopathic medicine, or the regular doctor, the way that I was trained, most of the remedies that we have are pharmaceuticals. And so most of the time when you go to the doctor, you'll walk away with a prescription,
right,
if you need one. And so people have done other things for centuries before there were pharmaceuticals that did work.
Right.
And not only that, but the pharmaceuticals, a lot of them are gotten from natural sources. So people are sometimes tired of taking all the drugs or the they're expensive and they don't always agree with people. And although they definitely serve their purpose, and I don't recommend anybody coming off medication, so that is not what I'm recommending, to take so-called natural medicine. But what I'm saying is that there are other things in addition to pharmaceuticals that can be effective. And in the case of the coronavirus, I started researching because I was wondering, I said, is there anything else out here besides, okay, well, we wash our hands. We've been doing that for a while now, and know how to cover our mouths. So some of the things that they were telling us were things that I think most black people do for the most part, do already. So it really wasn't anything new. So I started researching to see if there were other things, if I could find things in the literature, evidence-based. So this is not just, what grandma did, or, what you heard about, girlfriend said she heard this on the radio or something. I really wanted to look into the scientific literature and see, what other things were available. So there are a number of things. Some you've heard about. And I'll start with some of the more common things that people have heard about. Vitamin C.
Right.
Okay? So there's always been a lot of controversy. Does it help a cold? Does it not help? Or whatnot? But vitamin C really does help the immune system. And so we're not only talking about a cure for coronavirus, although there is not one proven, but we're talking about how you can protect yourself.
Right.
And one way you protect yourself is by strengthening your immune system and your immune response. So whatever germ that comes across, you can fight it off better.
Right.
Coronavirus or anything else. So vitamin C does help with that. And I have a few articles here that vitamin C an essential factor in the antiviral immune response. Okay?
Yeah.
And for the medical professionals that are listening in the audience, this works through the production of interferon, okay? Because there may be healthcare providers that are listening in to the program. And this is from the journal Immune Network, okay? And let me see I don't see the date, 2013 journal.
Yeah. So just if you were to sort of list the top 5 things that you found in your research that may be of benefit. Or there's vitamin C.
I would say vitamin C, and just another word about it. I'm not sure of the dose, and I'll just be upfront about that. I know you need a lot of it, when you're fighting off infections, and it usually comes in some ways it comes as in 1,000 milligram packets, or pills, and I'd say you probably need several of those a day to get to boost your immunity. And I don't know the exact dose, and I'll have to research that some more because I think it's different.
Yeah, I think that just based upon what I have seen, I think you need to, if you're talking about boosting the immune system, and even I actually use high dose vitamin C when I get those first flu symptoms, those first cold symptoms, and I usually take 5,000 milligrams.
Yes, I do
I'll
too.
take 1,000 milligram tablets. I'll take 5 of those. Yes. Yeah. And I do it right when I'm starting to get the aches, or you know how you say, oh, it feels like I'm coming down with a cold. That's when I start it. Now you really need to start it early, there is a body of research that does say that. So if you're talking about using it for, I think, immune system, you need to be somewhat high. The other thing though that you need to know is that vitamin C is one of those vitamins that you end up urinating out. Right.
So you can't overdose on it.
Yeah, so you can't overdose on it, but
and
it does have
another
some
thing that's
benefit,
helpful about urinating it out, it actually helps to prevent and mitigate or lessen the symptoms of urinary tract infection.
Yeah.
Because it builds up in the bladder and the urinary tract, and the germs can't grow around the vitamin C.
Exactly.
And so it does help when people have urinary tract infections. So that's where the excess goes out. So you don't have to worry about overdosing.
Any herbs, any other vitamins?
Yes. While we're talking about, I'm glad you mentioned about starting things early.
Yes.
Because with this coronavirus outbreak, this is not a time where you're going to just wait and see if you get better. Okay? You don't want to do that. Okay? What you want to do is the minute that you feel any symptoms or even think you have symptoms, start taking stuff. Okay, so if you feel a tickle in your throat, if you start coughing a bit, if you start getting chills and fever or anything like that, or a big symptom that they don't talk about is fatigue. Because sometimes you're just beat, you're just tired, and maybe your body's achy or whatever, and you just want to lay down and take a nap. Listen to your body. Because the other thing that I didn't say with stress management is there is no substitute for rest. Okay, you can't buy that at the pharmacy.
No,
Okay,
you can't.
nobody can prescribe it for you. But when you rest your body and lay down, that is when your immune system rebuilds itself.
Yes.
And that's when the fight goes on between your immune system and the germs. And it takes energy. But if you're taking that energy because you're running and you got to do this and you got to do that, that energy is not available for healing.
Right.
Okay, you have a finite amount every
Exactly.
day. Okay, when you recharge those batteries with sleep, then you have more the next day. But if you use it all up because you rip it and running and not prioritizing your health,
Yeah.
then it's not available to heal you. Then you can go downhill.
Right.
Okay, so I want to get back to things to do early. Zinc lozenges, okay? And I think the dose is about 15 milligrams. And what I learned in naturopathic school is zinc has a kind of narrow window. You don't want to, now, zinc is not like the vitamin C. More is not better,
Right.
okay? So with the zinc, I think 15 milligrams is about the max a day that you need. So you don't need to take 30, 60, 100, because when you take too much of this trace mineral, because the body only needs a little bit,
Right.
it actually starts depressing the immune system.
Exactly.
So if you buy them, look on the back, see how many. I know I bought some that said 11 milligrams. So maybe one, maybe two later in the day, but certainly not more than that.
Right.
And also you want to take it early, because what these things are doing is they are fighting the germs, fighting the viruses before they really get a foothold.
Right.
And that's like when you take them early, that is when they work the best and they're most effective. Because you know how it is. Sometimes you can let things go and let things go. And when you're like, coughing up the yellow sputum and temp of 103 and whatnot.
Yeah, no,
some of
you're not
these
trying to
things,
wait till
right,
then,
we're not
exactly.
trying to wait until then. So some of these things, they may help a little, but not like they would if you take them early on. Okay, and stay hydrated. So rest, hydration, stress management, vitamin C, and zinc. That's what we
Right.
got so far.
And I also know done some research on the benefits of green tea. And
Yes.
so that is another simple thing. In fact, there's been some reports out there that countries that are drinking a lot of the green tea, not the black tea,
Mm-hmm.
but the green tea, actually are not getting as much of the coronavirus impact.
Mm-hmm.
So I think that there's something to be said for that. There is a liquid product that is available on the market that has 300 milligrams of the antioxidant, right? And so
Mm-hmm.
that has been, I think, found to be beneficial as well.
Mm-hmm.
So any sort of parting things that you would want to tell the
Mm-hmm.
audience in terms of just if they're thinking about alternative medicines,
Mm-hmm.
what you would suggest, or
Okay.
what have you actually probably started doing?
And the other thing is essential oils.
Okay.
And I know these have been debunked in the major media, but they don't address the science when they debunk them. They just say, oh, this doesn't work, that's a scam or whatever. But when they actually look at the studies and look at the way that it works, in some cases they actually know the mechanism at the level of the cell, how they work. So I would say get a diffuser, especially if you have symptoms. Put a few drops of the essential oil, and some of the ones that I would recommend are eucalyptus, cloves, cinnamon, oil of cinnamon. I had a list of them that I'm not putting my hands on right now, but most essential oils have some antiviral activity.
Okay.
Tea tree. And so you can order or purchase a diffuser online. Here's my list right here. Lemon balm, and also there's one that I just recently learned about called Litsea, Litsea.
Okay.
There are studies from National Institute of Health on this, that it not only helps in infection but lung cancer as well.
Wow.
And there was
Okay.
a study about that. So that's Litsea, Litsea. It smells really good.
Okay.
And those, you want to breathe those in. Breathe in the vapors from those essential oils, and they do have, and studies have shown that they do have antiviral effects. So there are other Chinese herbs that you would really need to get from a practitioner. If you have an acupuncturist or a practitioner of Chinese medicine, Because there's a reason why the Chinese are getting past this.
Yes.
And
yes.
it's not just hand washing.
Exactly.
Okay.
Exactly.
They've got a whole armamentarium of different herbs and drugs and mushrooms and all kinds of things that are antiviral that they're not really.
They just
telling
got to
the rest
stay
of the
away
world
from
about.
the bats. Right? Yeah. they really need to stay away from the bats.
Well, I'll just say like they say in church, well, I mean, we don't really know the origin of this virus, and I'll leave it at that.
Okay. All right. Well, thank you so much again for coming. We appreciate you. This is sort of a different take on some of this stuff, and we want to have you come back and talk to us more about preventative medicine in the future.
Again, thank you for having me, and hope it helps. And
Oh,
stay well.
absolutely. Thank you so much.